just a quick sip and we're off to and running. So as a licensed veterinary technician and a VTS nutrition, I have lots of questions for you guys, and I'll be asking questions on behalf of the veterinary technician profession and observing on the side to pull any other questions forward. So let's jump right into it. What is this degree called particularly?
The degree which Lincoln Memorial University's veterinary school has under accreditation review now and expects to bring out next year would be a master's in veterinary clinical care. So it's a master's degree offered by a veterinary college, part of a university that's authorized to issue master's degrees.
Okay, excellent. Can you tell us a little bit more about how the degree came to fruition and who was involved in the brainstorming or mapping and planning this new program?
I'll start and then I'll hand it to my friend Jim. So Lincoln Memorial is a university that not a lot of people knew before it arrived in the veterinary scene, but it has 2 medical schools, 2 PA programs, physical therapy and occupational therapy programs, largest nursing program in Tennessee, doctorate in nurse practitioner, master's in nurse practitioner, and a vet school and a veterinary technology program. I mention all that for this reason. On the human healthcare side, particularly in Appalachia, Lincoln Memorial has been in the middle of a drought, if you will, chronic shortages across the board on human healthcare. And human healthcare realized that you couldn't just have a doctor and a nurse in this country and hope to even remotely meet the needs of the American public for healthcare. And when the university looked at the veterinary and the pet healthcare world, we basically had primarily, not exclusively, but primarily credentialed vet techs with a 2-year degree and certification from the national boards and DVMs and nothing in between. And as the shortage became more and more acute, and today it's a crisis, and we can debate whether it's a crisis. I think it's probably worse than a crisis at both levels, veterinarian and vet techs or vet nurses. The university, which has been a very innovative school, said, why don't we consider offering a master's program that bridges the gap and creates another professional and an opportunity for talented credentialed vet techs to step up, hopefully earn more, have broader authority and leadership opportunities and medical knowledge. So that dovetailed with the work that Jim was involved in, and I helped, but I want to give Jim a lot more credit, and the Veterinary Innovation Council, or VIC as it's known by shorthand, which had worked hard on telemedicine back in 2016, 17, and 18. And in 2018, Jim, maybe you can take the story there, because VIC took its own look at this issue, and it converged at some point with what Lincoln Memorial is proposing to do.
Yeah, so we started the discussion with the veterinary technician issue, and in fact, a presentation at the Pet Health Industry Summit in 2018 indicated that probably maybe as many as 70% of the veterinary practices in the United States don't fully utilize their technicians. And those that do utilize their technician, maybe only 30% of the skills and things they're trained for. So it's not news to anybody on this call tonight. But following that, actually the AVMA formed a task force to look at that, to drill in onto the topic of veterinary technician utilization. But the Veterinary Innovation Council, having just kind of almost wrapped up the telemedicine, telehealth, picked up an interest in veterinary technicians and technology, veterinary nursing as well. And because the AVMA was looking at the broad picture, actually the Veterinary Innovation Council drilled in to the topic of 2-year or associate degree training versus 4-year or bachelor's degree training, and we did a project around that. And that's not why we're here to talk about tonight. We can, but as we were doing that project and gathering data across the country from thought leaders around the profession, we heard a number of times, gee, what about an extender? What about, in fact, people use the term physician's assistant, the nurse practitioner. What about those things? Is that part of this? Well, it wasn't part of that project, but we took that idea after finishing the report on the 2-year and 4-year and the consensus we reached there. We took that idea of the extender, or the physician's assistant, nurse practitioner, and actually did an initial Zoom call with college out there. And once we did that, we heard, there were some people that, some schools, no, that's not such a great idea. No, we're not ready to go on that. But, there are a couple schools already. The University of Missouri already had a master's in veterinary science degree. The veterinary technicians were tracking through. And Lincoln Memorial had actually already started to draft a curriculum. So we picked that up and we did a project with that, and we assessed that across the profession as well, with very positive results.
And then I'll just pick up from Jim, Bree. What we did then was Stacy Anderson became dean when Jason Johnson went to a chief medical officer at IDEX, and Stacy's a tremendous leader and had been on the faculty. She's really taken it and shaped it very significantly since then. We then went to a number of groups, small practices, corporate practices, industry, shelter groups, a very diverse audience, and said, what would you think of this professional? And would you consider paying the tuition, which is going to be $25,000 total for a 3-semester program? Would you think enough of this professional that if you took somebody from your ranks and it was online and they didn't have to move and they could continue to work and do their clinical work with you, would you support it financially? And the answer was positive and strong. And we got a sense, you know what, let's develop the pilot. So that's led to it. And we can talk more. And obviously, Dean Anderson will get to that in the next session tonight. But that's kind of the origin. Right now, it's in final accreditation review by the regional accreditor. Every college has a regional accreditor. And once that's finished, the hope is to launch it in January. Hopefully that's realistic.
I'll just add, Mark, that at the end of that project, the Veterinary Innovation Council, the report that you and I co-authored, Mark, the council made a recommendation that veterinary colleges start to consider development of pilot programs like this. And so I'll just leave it at that and say that, so Lincoln Memorial is out of the gate first, but I know there are other colleges of veterinary medicine that are considering the same, considering similar training programs.
Thank you. So it sounds like there's quite a diverse group. A lot of thought was placed into this, and veterinary technicians was a big part of that conversation. So is this program specifically targeted for veterinary technicians, or who's in the market for this degree?
Great. There's two aspects to that question. It's a great question. Is it limited to someone who's a credentialed veterinary technician? No, it's not limited. But we expect that the lion's share, and I would guess 90 to 95%, just a prediction of the students would be practicing credentialed vet techs. You don't have to finish your bachelor's. And by the way, a lot of veterinarians didn't finish their bachelor's. They were able to go into vet school early. So you have to take some pre-vet science courses, because one of the unique things about this program is you'll be taking, alongside the veterinary student, anatomy, physiology, pharmacology. So the intent is to take the expertise that a successful, practicing credentialed vet tech has, and add some medical training that wasn't part of the 2-year program. There wasn't time for it. And then add a clinical component and add a leadership component, because it's really designed to create, which is what's happened in human healthcare, a new leader inside industry, inside a clinic, inside a shelter, that understands all the things that a credentialed, nationally boarded vet tech can do, right? Which not every veterinarian knows. Let's be honest about it. They don't understand that. So somebody who's lived it, done it, who can be, with additional training, a bridge between that team and the medical team, and actually be a leader in that team, and talk to doctors, eyeball to eyeball about medical issues, because they've been trained. So it's that combination that we think will be effective. But Stacy will talk about it, and I know Jim's frozen here. Apologies. But we do expect that there'll be some people that say, as often PAs do, I'm not going to go through 4 years of med school and then 4 years of residency. I want to get into my profession sooner. There'll be people that think, I'll do this. The pay is going to be, we think, significantly better. And it'd be a career opportunity and a leadership opportunity, and people may decide. But I think most people will be senior vet techs credentialed vet practices, shelters, organizations say, you've earned this chance, we'll fund you. Hopefully it's a good program. You don't have to leave or move, so you can do it online, which I think should be attractive.
Yeah, definitely. I think that
So I
would be a big changer.
So I turned my camera off, so maybe I can keep my video or my audio going. But I'll just add that the core of the science courses and training, the core of critical thinking skills, the core of leadership skills is what's going to make these individuals extremely valuable in the practice setting. And again, as Mark says, those that have that critical background as a technician, it's going to just make them step right in and take off.
Mm-hmm. So that kind of loops into potentially an impassioned question, is that if you have a student who is not a credentialed veterinary technician that obtains this degree, would they then be seen as credentialed and could operate like that in a practice, or they would still have to sit for, the national exam and everything?
I'd be very clear about that. That's a great question. That's a really good question. If you're not a credentialed vet tech, which means you've graduated from an AVMA accredited program and you've passed the VTNE, administered by the American Association of Vet State Boards. If you're not a credentialed vet tech, you can't do the things a vet tech does. So this isn't a backdoor way, and by the way, it'd be a harder way to do it because the course load is frankly more rigorous alongside veterinarians taking gross anatomy and the like. I think there'll be career paths for that person if they want it. In practices or in industry, but they can't do what a vet tech does. I do think what's going to happen is, let's be honest, vet techs do not make enough money in this country. They're not paid enough. They're not paid what they should be, period. There's no way to say it politely, and it's a shame. And the industry and profession should have taken that on earlier, and they haven't. So don't expect an underpaid profession to then leave their job and go spend $25,000 on a master's. So the key to this is to bring organizations in that will fund that and then utilize that person understanding it, but also have that person play a leadership role with the vet tech team now, who understand what the skills are that a credentialed vet tech has and they've been certified to have. So I think that's really where the focus is going to be, but it's not going to say to somebody who wants to do this, for whatever reasons, if you meet the science academic requirements, you can get the degree, but I don't think that'll be a large percentage.
Okay. Just want to make that clear. Thank you.
No, that's a good question. That's a great question.
So it sounds like, with this pilot, the technical role is still sort of being mashed out, and we all know that standardization for veterinary technicians in general is a really hot topic right now. So what potentially would that role, or would you feel, would that role be in a clinical setting, in a university setting? What would that title be? And do you think that, like this pilot, and as more of these pilots pop up, that this is going to help really emerge, the standardization across the board for technicians and start to get the ball rolling a little?
I can't say that it will have an impact on standardization of a credentialed vet tech. This is a pilot, and what people need to appreciate, and frankly, I'd hope everybody watching this tonight would say, it's great to have schools like Lincoln Memorial that are willing to have pilots, because you know what? Not every pilot works. And if it doesn't work, it doesn't work, but we've learned something. But the practices, the shelters we talked to that were enthusiastic about this, envision this. One is that this becomes someone who could manage the veterinary care delivery team. Let the veterinarians practice medicine. They're not really trained in vet school to manage. They're not trained to kind of organize nurses, vet assistants, the array of aspects, including diagnostic support. And so I think for corporate practices, for industry, it'll be a management role, an oversight role. It won't be a new title. We're not going to the legislature saying, call this a veterinary nurse practitioner. We had all the fun we had with veterinary nurse degree, seeing how the human profession came in and fought that. So I think for smaller practices, what we learned is that they're having a really difficult time right now competing with larger practices for salaries to hire vets. The shortage is so acute. Shelters have no chance right now. I mean, they've been very blunt with me. Mark, we cannot pay starting salaries for veterinarians. We're not even close. Small practices have that same fear. This person can play a role much like a physician assistant, where you help work up a case. You don't make the decision, you don't write the prescription, you're not doing surgery, but you're not doing the official diagnosis, but you're pushing that process along and allowed to sort of help the veterinarian have greater coverage when they can't hire a veterinarian. So I think those two paths. I think in shelters, it's a leadership role, and I think in industry, it's a myriad of roles. Our friend, our spiritual leader, Catherine Haskins, has rejoined us. So I mean,
what this means is, first and foremost, I love all the questions that are coming in here. So what we are going to do is allow all of you to go back to the tables. You don't have to push a button or anything. We're going to do this in a second. And it's going to allow this group, along with Stacey Anderson, Dr. Stacey Anderson, to look at these questions. What we're going to talk about next is the actual curriculum. So there were pieces in there about the questions but I want to be sure that you understand we are looking at those. We're going to bring those forward, and then we're going to have a full Q&A. So keep bringing them on, people, because this is important. This is really meant to be something that you are a part of the conversation as we're going forward. So what you can either talk about your own questions you have submitted here, or is this something that you feel this type of professional would be helpful to your practice? That is the question I would like you to talk about at the tables. But before we go, it was raised. What is the degree again? Can we get the name of the degree really quick?
It's a master's in veterinary clinical care.
Okay, so now you know the name of the degree. Do you think this would be helpful for yourself or for your practice? We are now going to go to the tables. We will come back and engage back in our conversation.